Good morning, Dr. Miller.
Good morning.
We are here in El Salvador with a beautiful sun, and I'd like to talk to you today about the sun.
I love the sun. The sun is so good for us. There's been a lot of negative press lately about the sun, especially from the American Cancer Society. And they have good intentions because they want to help prevent melanoma. Melanoma is a deadly skin cancer that can kill you if not detected in time. And about 8,000 people die every year from melanoma. But melanoma can be detected easily because it can be seen. This is one cancer you don't need a test for. You see a black spot on your skin, a mole or something, have it checked out and have it removed, and you won't die of melanoma. It's simple. The problem with avoiding the sun, a recent study just came out showing from a public health standpoint, 340,000 Americans are dying every year from lack of sunshine. That's an enormous number. Compare 340,000 against the 8,000 that might die of melanoma, and it's a no-brainer. More people are dying from lack of sun than are dying from the sun. And no one has to die from the sun from melanoma. You can see it and remove it. What are some of the things that people are dying from? Well, it affects our vitamin D levels, and you can take vitamin D, but the sun does much more than just vitamin D. It also gives us all kinds of transferase and different things that it does for our body, for our brains, and it has a lot of beneficial effects. One of the things that they found that people are dying in increased numbers of heart disease, cancer, especially cancer of the breast, all kinds of autoimmune diseases, of heart disease, high blood pressure, strokes, all those things are increased dramatically. That's not to even mention what it does to our mental health with this seasonal affective disorder. So many people are sad in the north where they don't see the sun and they commit suicide. And so we need it for our mental health as well. You know, sunshine goes way, way back in the Bible. It also goes way back to my grandparents' time. My grandmother lost 7 of her siblings to tuberculosis. And in the day, they had no medication for it. And so a lot of the people that were dying of tuberculosis, they put them out in the sun to enjoy their last days out in the sun, relaxing. And surprise, surprise, many of those people were cured from tuberculosis just from the sun. We need the sun every day. One thing we should avoid, the Cancer Society is correct on this, we should not get burned because burning can cause cancer. We should protect our eyes with sunglasses so we don't get cataracts. Another interesting study that came out about melanoma is that people that get sunburned on vacation are at an increased chance of having melanoma. However, the people that are out in the sun every day, like roofers that are out all day in the sun, they have less chance of getting melanoma than the general population. Isn't that amazing? The body adapts to the sun. It needs the sun for vitamin D because we can't get it from our diet. And we even talk about COVID. And COVID, so many people died because they didn't have vitamin D. Almost everybody that died of COVID was very, very low in vitamin D3. And they didn't get out in the sun. They stayed in the house all the time. They were social distancing. And so they ended up getting COVID. Yeah, in Haiti, where I practiced for a number of years, the people walked out in the sun all day. They didn't even get vaccinated for COVID. They didn't have a problem with COVID whatsoever. And here in El Salvador, the infection death rate was very, very low for a couple of reasons, but one is that they got out and exercised in the sun all the time. We need the sun. Our bodies were built for the sun. God gave us the sun as a blessing to us. It keeps us warm. It feeds our plants. It's something we need to get out and enjoy the sunshine every day.
Thank you, Dr. Miller. Again, you're saving people's lives with your information and your wisdom.
Thank you.